Good afternoon. My name is Daquan Mitchell, and it is my pleasure and honor to speak and shed insight on the effects of intimate partner and family violence on the mental well being of adolescent children between the ages of 13 to 17 years of age in both males and females. I would like to first give honor to God, which is the head of my life, that He has given me this precious and gracious opportunity to be here today speaking in front of all of you at this Christian Communicators Conference. So before we get started, let's go over our objectives. What will we learn? We will speak about the definition and classification of mental health, characteristics of the different forms of violence in which occur within a home and how it targets adolescents, teens, aggravating factors of poor mental well-being and how it affects the quality of life in adults and adolescent teens, the effects of mental instability as it pertains to the functionality in school and work settings within adolescent teens, the correlation between the perception of traumatic violence in the home and the quality of life in adolescent teens as they continue to grow, as well as tied in communication factors in which could be implemented to accomplish diverse brainstorming techniques and conflict resolution. So you might ask, what's the purpose of this whole training or conference session? Uh, so this research aims to portray the correspondence between intimate partner and family violence with the progression of poor mental health factors such as anxiety, depression, post-traumatic stress disorder, suicidal homicidal thoughts, eating disorders, low self-esteem, and physical aggression, resulting in malicious behavior or attention seeking in adolescent teens between the ages of 13 and 17 years of age within our male and female groups. Furthermore, this research will provide tactics of positive and healthy communication methods in which will progress the quality of life in adolescent teens while in work, school, and family relationship settings. So before we get started, I just want to iterate that I do have a video attached here with this lesson plan that is available for each of you. And the video is a TED Talk video in which expresses the correlation between childhood experience trauma due to family violence, intimate partner violence, and addiction with the adverse effects it has on a child's life as they get older. The talk goes into detail about how over 17,000 people were put through a study, and the ACEs were a direct correlation between the level of trauma experience and the condition of mental stability and health. The video is over 15 minutes long, but when you watch the video, I want you to focus on the first 8 minutes or so of the video to understand the correlation between traumatic experiences resulting from family or intimate partner violence with mental health and stability for children and adolescent teens between the ages of 13 to 17 years of age. So, diving or going further, what is mental health? Mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. As we go further, and as you actually have an overview of this lesson plan and of the speech here, it'll actually have all visual aids attached within the speech. So as you go through, you can actually refer back to this video and see how the visual aid actually helps the presentation here today. All right. So a few questions I want you to keep in mind as you go through day to day, whether you encounter those with mental illnesses or attempt to assess each person as you have a conversation, listening to their auditory or visual cues, and things of that nature. I just want you to ask yourself this question: is poor mental health subjective to one race or gender? Does mental instability portray the same signs in all individuals? Can communication styles such as active listening, both auditory and visual, assessing verbal and nonverbal language, brainstorming, and conflict resolution affect the outcome and quality of life of those suffering with poor mental stability? Is it important to intervene at the first signs of mental instability in adolescent teens by way of interventions, mentorships, and focus groups? All right. To kind of understand the aggravating factors of mental health or poor mental stability, it is important to understand the types of violence and things in which that could happen inside of the household to drive us to that point. So the different types of violence experienced within the household, especially within this control setting: verbal abuse, psychological abuse, emotional abuse, physical abuse, criminal sexual conduct, rape, and contributing to a minor in instances of alcohol, drugs, and other illegal substances. So, in order to understand the aggravating factors of poor mental health in adolescent children, we must first understand how adults are affected. From drug addiction, substance abuse, alcohol addiction, traumatic head injury, and witness or perceived past traumatic incidences, many of these factors may evolve or progress in unhealthy mental stability balance in adults. As we have learned, or as you will observe in the video, the effects of any traumatic experience, such as family violence, sexual violence, verbal abuse, physical assault, and drug, alcohol, or substance abuse, drastically correlates to the deterioration of the quality of life versus those in which do not experience these types of traumatic incidences. Because of these violent incidences, further addictions are formed. This may take shape in drugs, alcohol, illegal substances, adrenaline experiences, near-death asphyxiation, repetitive abusive behaviors, and/or extreme sexual encounters and experiences. In turn, adolescent children are affected during these precious years, and the adults within the home are perceived and labeled as the aggravating factor for the deterioration of their mental stability. It has been discovered throughout conducting this research that direct exposure, excuse me, to violence is associated with adverse mental health and substance abuse outcomes among children and adolescents. Child sexual, physical, and psychological abuse are all associated with adverse behavioral health in adulthood, as are co occurring childhood adversity and abuse. Current intimate partner violence is associated with substance abuse among adolescents. As interpersonal violence increases, so do the odds of behavioral health problems. Even more intriguing, though, parents in which have a mental illness places their children at a higher risk of experiencing abuse or neglect, but also double the time more likely to experience childhood sexual assault than that of children in which parents do not sustain a mental illness. Children in which have parents that suffer from depression are also more at risk of developing a mood disorder. Now that we understand a bit of the aggravating factors, we can dive into how this age group of the adolescents are affected. It is drastically shown that without the proper intervention and mentorship tools put in place to communicate emotions, discuss options, and hold people accountable, adolescent female teens, in which were victims of family and or intimate partner crimes during their youth, grow up to commit violent and sexual crimes to others within and outside of their family. This is a great example of the revolving lifestyle of violence and poor mental stability in which was left unchecked and overlooked. The effects of mental health not only affects the individual in which suffers from the mental health condition, but others around them are also affected. Having poor mental health also affects the way in which tasks are completed and approached. For example, concordant with previous consciousness evidence, traditional absenteeism computation indicated that elevated psychological distress is associated with the increasing absenteeism. Mental disorders are a leading cause of disability, being linked with substantial increased absenteeism from work. Current data indicates that depression alone produces $33 billion lost to the U.S. economy in absenteeism. In this study, it shows how depression is linked to an increase in absenteeism amongst other forms of poor mental health. Underlying factors in which result to obtaining a poor mental health status involves verbal aggression, mental abuse, psychological abuse, physical abuse, sexual abuse, and addiction. Each of these factors in which are observed or perceived within the home affects work relationships and work habits to the point that days are being missed at a drastic rate. Although a separate study within the article calculates the hours of absenteeism to be low due to the employees working overtime to make up hours missed to keep their job, the number of actual days missed is substantial. The journal article titled Organization Based Self Esteem Amongst Mental Health Workers, a Replication and Extension describes how experienced self worth in one domain is likely to be correlated with experienced self worth in other domains. Simply meaning that if I have a high self esteem to myself, a high presence of myself, that's going to correlate to my work ethic and how I associate my task at work. But if I have a low self esteem about myself within my personal space, then it will show in my workspace. Factors in which affect self esteem within adolescent individuals consist of bullying by both parents and peers, assault or abuse, and effective communication. Communication is a major aspect in self esteem because it provides affirmation, confirmation, problem solving, and brainstorming techniques in which allows a person to feel more confident and in control of themselves. So, this preferred study consisted of 50 adolescent teens between 13 and 17 years of age. After administering pre assessment tests and individual interviews, the 50 participants were categorized into two groups. There was a group of 13 males and 12 females in which displayed a form of mental illness while advising and contributing it to violent actions and aggressions within the home. The other 12 males and 13 females did not indicate any form of violent activity within the home, neither did they portray or address any signs of current mental illness. Through further interviews and focus groups, it has been discovered that the 25 male and females between the ages of 13 to 17 have shown a decrease in school attendance and their GPAs, but an increase in violent disputes and suspensions were appeared to be visible. The 25 male and female in which experienced violence within the home furthermore advised of the lack of extracurricular activities which contributed to the violent outbursts in school settings. Furthermore, it has been disclosed that the work history in adolescent teens in which witnessed violent activities at home displayed higher levels of breakdowns and manic episodes at work. Oftentimes, the participants would advise that they would simply call out to keep from having to deal with emotions at work as a result of what is happening at home. To touch on the communication aspect, the essential component of providing relief for abuse adolescents victims would be to intervene within the household, assess the disruptive measures, and initiate an intervention. This will start the effective communication process on every end, in which will allow both children and adults to effectively express their emotions and feelings. This is an important step because the teen and the adult obtains the resources and help needed to bring awareness to the problem, brainstorm options of different paths and outcomes in which could be generated, and constantly provide conflict resolution. This also allows all parties to self assess themselves. Before any problem can be addressed or fixed, there must first be some sort of acknowledgement or awareness that the problem exists and that there is a need for a change. This change comes in many forms to include DSS, law enforcement, rehab, anger management, counselors, medication, mentors, and any other resources available to intervene and provide resolutions to the revolving conflict. Many may not see law enforcement as a tool or resource, but in violent situations dealing with family members and intimate partners, an arrest or law enforcement contact and presence is the best course of action to be taken. This generates a sense of reality that something bad has happened, and if it does not get fixed, it will lose the ones in which are claimed to be cared for the most. This will then drive a sense of fear into the perpetrator, which will guide him or her into doing what should have been done from the beginning and creating a more positive and healthy relationship. Resolutions could also be consist of supervised family vacations where all members are taken out of the environment in which they are in and placed into a more relaxed setting. Allowing the group in which does not experience violent acts within the home to be part of focus groups at different stages allows them to gain a better understanding of what the other group goes through. Instead of adding to the tension or conflict, they can help manifest change while breaking the chains of abuse within the home. To check for understanding, a post assessment and quarterly survey will be generated amongst both groups to track change in relationships, awareness, spread conditions of mental health within the affected adolescent teens, and provide a chance for periodic reevaluation of choices in revolving circumstances. Thank you for your time today. I do appreciate it.